doing before we get into the webinar proper.
Yeah. No, that's good. Oh, that's right. I've got to share my screen. That's what I can do in the meantime. So, Barbara, I manage you as... Oh, I don't know what's wrong with this computer. It just keeps on giving me little windows.
Okay, I'm just going to try to close some of my...
Right, okay. Now I'm going to do manage participants. Then I'm going to make you a co-host, Barbara. And then you can drive it from your end by... there's a little... Oh, now I've made it too big. Oh, this computer. I got this computer upgraded and it's never worked since. So at the very bottom of your screen, Barbara, you should also now have this share screen green thing. So you can...
Should I click share screen? Yeah.
And then that way we're seeing your screen, not my screen now, I think.
Yeah, I think so.
Yeah, there we go.
Can you see anything?
Yeah, it's good.
Yep.
All right. So do you see fundamentals of research?
Yep.
Okay, when I click, do you see anything? Hold on.
I can see that there's 75 slides.
It is divided into 2 sessions, Donna.
We don't need to go and get a coffee or anything.
You may need to go and get a coffee at one stage, yes. But do you see, hold on just a second. Let me try to change the next slide. Has it changed?
Yeah, it's good. It's really good.
All right.
Yeah.
Don't worry, Donna, there's 75 slides which are divided into 2 sessions. I didn't want to split them.
Yeah. Barbara, are you looking at it in the just in the normal PowerPoint view, or have you got it as the presentation view? Because we
have it as the normal PowerPoint view without it being what do they call it, expanded?
Yeah, no, that's good because that's what we can see too.
Hold on just a second. If I move that.
Well, now I can't see anything.
Yeah, I shouldn't have moved that. Let me move it back.
That's it.
Yeah, that's better.
That's better.
I mean, did you want to go to the slideshow view, Barbara? So we can't see that panel on the slide. But not that it really matters. Yeah.
All right. Can you see it?
Yeah.
Yep.
All right. Hi, Belinda. How are you?
Hi, how you going?
Good. How are you doing?
Good. Sorry, I've hidden myself in case I have to rush out to the bubs. Hi, everyone.
Hey. And we've got in the room as well, we've just been joined by Stephen and a colleague of ours, Peter Svensson, who's working on the novel interventions for methamphetamine in Aboriginal communities. Yes, it's only taken me 18 months to remember what that acronym is. A meth focused project that's being run by James, James is the chief investigator, is being run out of this unit too. So we've kind of extended the invitation to attend these webinars to wider than just the CRPs, just because we realised that there were a lot of similarly placed researchers working with the different groups coming out of SAMRI that could do with a lot of this training as well. So, so welcome. And
I think we have Annie online as well.
I think now that it's your screen, Barbara, I can't see any of it. Oh no. I don't know. I'll stop touching things because I think that we're both doing it.
Okay. So hi everyone. I know it's about 10 minutes past 9. So what we'll do, we'll try to get into it so that everybody can get back to what they normally do during the day. Thanks very much for attending. I know it's this takes up your time, but hopefully you will learn something new today. So before we start, usually we go from one PRP to the other just to get an update of how they're doing and just to highlight any major challenges that they may be facing. So from my screen here, the first PRP I see is Kutsi. So maybe we'll start with you. Just really highlights of what you've been doing over the last 1 month and any issues that you may want to bring to our notice.
Yeah, for the last month I've been just tidying up my PhD because it's due for submission in June. I'm on to the last discussion, so part of me is over it, but part of me needs to do it properly, otherwise it's going to be worth nothing if I don't do a proper discussion. No, but it's good. It's been really well. I'm looking forward to getting back to talking to all the men, to letting them know how everything went, and yeah, hopefully the few papers get published.
Okay.
Well done. Well done, Kutsi. That's amazing effort. It's hard work.
Thank you.
Sorry, it's Belinda.
Yes. And usually they say you get permanent head damage by the time you're done. Hopefully you'll be fine. Yes. Okay, Belinda?
What have I been doing? I've been just refining that HPV study that we're working on. And at the moment, we're looking for possible funding, which is interesting. So fingers crossed we'll have a few people to talk to soon about funding the study. So it's just up to that phase, and then we'll work on protocol and ethics and, all those other fun things.
Okay, thanks, Belinda.
No worries.
Annie?
No, I don't think we've got anyone else on there. We've got Stephen is here. You can't see him, but when you speak, he speaks. You will, but I can't see anyone else attending this.
And Annie's at the bottom here, though I can't hear her.
Oh,
Maybe she can't hear me either.
no, I can't see anything. And I don't know who's driving this computer, probably both of us.
Okay. Anyhow, so Stephen?
Yep, so I've just been progressing my individual projects for my MA. So just getting one of those started so I can kind of get going with one of my projects. So it's all kind of progressing slowly, but it will get there.
Okay. All right.
Ah, is that Annie?
Yeah, I can see Annie.
Can you
Yes,
hear
I
me?
can see Annie.
Can you hear me?
Yes, we can hear you now, yes.
Oh, good. Thank you.
Okay. Hi.
Hi.
Hi, Annie. So just update us on anything you've been doing in the last 1 month, Anne.
I haven't done anything else. I just have not had time. I've had a bit of leave and I haven't progressed. I've had a few conversations, as I discussed before, about putting up a concept sheet. So I'm just working out a few more details with that and sorting out supervisors.
Okay.
I need to move because I think closing is very soon.
All right. How many supervisors have you identified so far?
3.
3, okay. And so that is Rebecca.
Louise Corser and Raylene Hyun.
All right. That's very good.
Annie, did you get any answer back about a fish, like formalising Raylene's involvement, or do you need me to?
Yes, we're still waiting for that. I think the Kirby mob have been pretty caught up with finalising a couple of papers.
Yeah.
Yes, it was going to look like Rebecca and Louise would be co-lead, and then Raylene would be a secondary supervisor.
Brilliant.
Brilliant.
I think that's what we decided, but that needed to be confirmed at University of New South Wales.
Well, let me know if there's anything just like paperworky that I can help, follow up for you.
Yeah, thank you. Yeah.
We have someone else on the line called Gary.
Gary might be from
Virtual.
From Virtual. So Gary, I believe, hi Gary, I'm Claire. Are you connected with the Goanna project and Selena Elliott's invited you into this? Possibly?
I can't hear response, but that's fine. I don't see a video, so most likely either it's on phone or something.
Okay, so it's not muted, but sorry if I'm speaking for you, Gary, speak up if you can, and I'm getting it totally wrong. I believe Gary's been working with a colleague of mine on Goanna 2, a revised version of the highly successful Young People Survey of Behavioural Risk Factors and STIs and BBB, prevention and safety. So that James published the last Goanna, or the first Goanna report in 2014. This is a revision of that work, trying to see whether attitudes and stuff, behaviours have changed in the last couple of years. So welcome, Gary.
Okay, so welcome.
You're the right person that I've just described. Cool.
All right, thanks, Claire. So thanks everyone again, and many of you know me. My name is Barbara Natabi. I'm one of the CIs on the Centre for Research Excellence in Aboriginal and sexual health and blood-borne viruses. But I'm also a senior lecturer here, and I'm based in Geraldton, and I work at the West Australian Centre for Rural Health, which is part of University of Western Australia. So today our discussion is, and I really want to make this a discussion because, as I told Claire earlier on, though we've been calling this capacity building, I think a lot of it is actually capacity strengthening, because quite a number of you online have either conducted research or led research or participated in it one way or the other. So in a sense, nothing here will be very new for most of you. Donna, this will be, you could do this in your sleep. Belinda, you're a postdoc, so quite a number of you already have a lot of experience. So what I'm hoping that this will be a discussion, but what we do know is that though a lot of us may have done research for a long time, sometimes there are things that you learn along the way, and I think it's good to have revision around some of these issues. I did send out a task for everybody, and what the purpose of that task was is really to engage the group, and I do hope that all of you had an opportunity to read the paper that we sent round. If you haven't, please do so, because it's a very interesting read. So an overview of this session, as Donna pointed out earlier on, there are 75 slides. So actually this is split into two. So I'm not going to present 75 slides today. And in fact, I'm not actually going to present all the 30 slides which are intended. So some of this material, you can hold on to it later for your own purposes. So really, I'll just be highlighting some of the key issues. So we'll discuss quickly what research is, why we conduct it, a bit about the process, and a bit about how to develop a research protocol, and what the key elements are that you should have in a research protocol. So I pulled out the two upper definitions from my Collins English Dictionary, and really it was just to highlight what research is, and basically what it is systematic investigation to establish facts about a particular issue that we're interested in. It involves an investigation, analysis, and examination of a particular interest, whether it is a qualitative study or quantitative study. Really what we're trying to do is to examine a particular issue or to investigate it. The Higher Education Research Development, the Higher Education Research Data Collection 2016 defines research as the creation of new knowledge or the use of existing knowledge in a new and creative way. So, for example, a colleague of mine recently asked me if a systematic review is real research, and that was her quote, because you see quite a number of people doing systematic reviews, and she thinks, that's not research. But this definition encompasses that because a systematic review is basically the use of existing knowledge to create in a new and creative way as well. The research criteria, therefore, are that research should be novel, that it should be something new, that we are trying to produce new findings. It should be creative. We should be uncertain about the outcomes. If we already know something about an issue, we shouldn't be doing research about it unless there's something new or creative about what we're doing. It has to be done in a systematic way, so it has to be planned and logical, and that's why we have to write a research protocol. Whether you're doing a systematic review or whether you're doing pure research, it's very, very important to write a protocol to show that you're doing it in a planned and logical manner. And research should be transferable and or reproducible. And that's why we write a protocol, because people should be able to reproduce your research and be able to come up hopefully with the same findings. Research has to have merit. We must be answering an important question. And usually when we start research in the beginning, we all come up with all these ideas. And sometimes the questions that we develop aren't quite particularly important. And that's why it's very good, and I'll discuss this later. It's very good to discuss this with other people, because people may say, Barbara, that question is really important to you, but it's not in the scheme of things very important. Because research takes time, it takes effort, and it's not just the effort of the researcher, but it's also the effort of those who we research on or with. So it's important that the question is important enough. It must be done with integrity, and there must be justice when we're doing our work. There should be a fair selection of participants. We shouldn't look only for the vulnerable people just because we want to do our research. It must be of benefit to the people on whom we're doing, with whom we're doing the research, and the benefit might be immediate, the benefit may be later on, but we must be able to articulate very clearly what the benefit is to those who we're doing research with. Otherwise, we shouldn't be conducting research. And of course, we must have respect for those who we're doing research with, and people must have the autonomy to participate. So why do we conduct research? Of course, hopefully to make a difference. Many of us online are health workers or researchers, and hopefully what we're trying to do is to make a difference for the people we're working with. When many years ago I was teaching nursing students about research, I told them how important they were, of course, to patients. But I told them that it's important for us that when we want to improve the lives of our clients and all that, that we're doing research that shows us what the best treatments are for our patients and the best approaches are. And the only way we can do that is by conducting research. And of course, to fill the gap in knowledge, whether the knowledge is for us, for the community, or the government in general. So these are the broad steps of research, hopefully, and usually they don't usually follow particularly in this lines. Sometimes it can be a bit iterative, but hopefully we start with developing an idea and we consult with others. And the importance of consulting early and continuously cannot be overemphasized. Recently, I had what I thought was a very, very brilliant idea, and I spoke to Rebecca Guy, and she said, "No, Barbara, I don't think that's quite a good idea." So I've had to go back to the drawing board. So if I'd continued on with my idea, probably it would have wasted a lot of people's time and energy. So it's very important to develop an idea and to gain support from other people. Of course, the people you want to work with, but to consult as early as possible. Collaboration is key, and I think we all know this. It's important to create a team. And sometimes the team, of course, we think in terms of researchers most of the time, but sometimes we have to think more broadly and think about involving people who are at the coalface, because they're the ones who tell us, "Oh, Barbara, you sit in an ivory tower, that idea of yours isn't quite smart." So we have to think very hard about collaborating and putting onto the team other people who we think might be of use for us as well. So sometimes even people might include community members on their team, not just pure researchers. Of course, you develop your research question, and we're going to talk a bit about this. The paper which I sent around was talking about how to develop a research question in a particular format, but one can use other formats as well.
Barbara, it's Annie. Can I ask a question?
Yes.
This is one part I get a little bit confused about, because if you're doing a PhD or a master's or a research project, you're kind of going along with your supervisors and everything. So how do you engage other people in the research? I find that a little bit confusing. Or are you talking about like if you're starting a whole research project, which we aren't necessarily doing?
So let me give an example of myself. So when I was trying, because it was an idea I came up with, and I contacted Claire, and we had a discussion with people in IUE. And so we just had a teleconference. We didn't meet because, of course, they're all up in Queensland. And we just had a general discussion because I thought that this was just a 2-page I sent out to them. And so I just began discussing with them, what do you think would this idea work in IUE, for example? And so I immediately went to the site if you know what I mean. So, and even you, for example, you're starting your master's project, or your PhD, you may think to yourself, okay, we want to do this work with people up in the APY lands. So you may begin having discussion with the elders or with other health workers. So they might even just be informal discussions, but you're sort of paving your way and beginning to think about, where would my research base be placed? Who will be able to support me? Who else can I get onto my team? And maybe not necessarily your supervisory team, but on your mentorship team, or people who can assist you along the way.
Okay. So more in the proposal phase.
More in the proposal, even sometimes even before you start even writing the proposal, having a cup of tea with one of your colleagues, having a cup of tea with Belinda, for example, and discussing some of these issues very, very early on, calling up Claire and all that. So all that is beginning to engage other people within your proposal.
And Annie, I also think that, when you say are writing an ethics submission, often they will ask you, do you have any letters of support, or have you had a peer review of your research proposal? So if you think about, well, who would you get a letter of support from? Those are the people that you should probably be talking to now, because if you go to them with this fully formed thing, they may or may not support you. If they're actually helping you to form the thing, they probably will support you, because they're just supporting their own ideas, or what they think is their own ideas, whether it is or it isn't, doesn't matter. And also, in terms of peer review, I know a lot of ethics application asks you, have you had peer review of this? And the peer review obviously would be not from your own team, but from perhaps a researcher or a research team that works on something similar, and that could give you some, I guess, be a critical friend.
Now, I just suppose I was thinking about it as a student and how you would form formal collaborations, but that's not what you're suggesting.
I think, so are you asking whether or not a PhD student can actually have those larger research things? And because, you certainly can, and you need to be your project or your PhD's chief investigator, and you have the team around you to support that. In a lot of these projects, it is just, your PhD is driven by you, but it's work that can't solely be your own work. Your supervisors are part of your teams and whatever, and also in this context, you need to be working with your with the services that you're going, and the communities that you're going to be working with, and I would just totally agree with everything that Donna just said then. This community engagement and has been something that I've been thinking about quite a bit in the last couple of weeks, and just how having a kind of top level agreement with the communities or the services that you're trying to work with is good. That's a necessary step, but I think a lot more needs to be put in, into really getting those communities and services involved in the shape of the research that's going to take place, and really get some good buy-in at the beginning, because when you only have the top level, it takes so much time and effort to actually...
Yeah, I'm totally there, and I understand.
Actual engagement, actual implementation of that work.
I was just thinking about being very much about myself and about my actual role as a student, and how that fits in compared to, like a big research project that's going about doing big research. That's all.
Annie, it's Belinda. Is your PhD going to be on Tango 2 or any of those existing?
Yes, some of that evaluation. So those things are already there, partly around.
Yeah, so you would have been involved in those initial discussions with Tango 2. So just as part of your role. So you've already kind of been doing it already.
Yeah, but there's other components to it as well. So,
and then your actual PhD, you'll be involved in creating those questions, and that'll come from the ground up, because that's where you work. Yeah.
So there might be some slight differences between what you do as a PhD student and a larger research project, but the development of relationships is very key at the very beginning.
Yes. No, thank you.
Okay, so thanks everyone for pitching in. As I said, this is a general discussion and a lot of you have been involved in research. So thank you very much for that. Put up your hand anytime you have a question. So of course, then you develop a protocol and we'll go through some of the key elements which should be in a protocol. Of course, you assess whether or not you have resources or not. And time, I think, is the most essential resource you always have to find out if you have enough of. Ethics approvals, of course, are necessary. And I do know a lot of us, including myself, you know, we almost go crazy when you think about ethics and writing those approvals. But I think a lot of times, especially for me, it gives me an opportunity to think about the benefits, because we always think, oh, my research is going to benefit someone. But I think it actually takes us through the process of thinking very hard about, does my work actually benefit other people? So ethics approvals, of course, to have their of course, not only protecting the people, but also for us as researchers. Then, of course, we go through the data collection process, analysis, and of course, writing up the results and disseminating them to a broader audience. So we're going to talk about the protocol, but we're not going to talk about all the elements of it because we don't have enough time. But the protocol basically guides our research, and all basically it's doing is to tell us about the what, where, why, who, and how. In this session, I will talk mainly about research methods and talking about qualitative and other methods, but these are in summary the elements that we must think about when we're writing a research protocol. The background usually has a literature review, research methods and objectives, and the methodology has all those elements as listed there. The ones which are in bold, I'll talk about briefly. So I saw these resources online, and those are the links I've provided, and there's a lot more online that you can find. A systematic review is basically a systematic gathering of information around a particular topic, which aims to describe, summarize, and evaluate the literature around a particular issue. I personally, right now, I'm doing a Cochrane review, and a Cochrane review is on the higher side of a literature review that is done in a very systematic way, because of course Cochrane reviews then go on to make guidelines around different issues. But they're basic, sometimes what we call just narrative reviews or very simple reviews. So there's a whole range of types of literature reviews one can do, and this we'll cover possibly in another session. But those are the links to how to do literature reviews if anybody is interested. So the major thing we're going to talk about today really is research question development. And as I said very early on, it's very important to determine whether or not this is an issue which is important to anyone. I had this issue just a few weeks ago, and I thought there was a very important issue to myself, but found out that possibly nobody else would be very interested in the outcomes. And so since sort of put it on the back burner. So we have to determine whether or not this is a problem or issue for the community, because sometimes we researchers, we sit in our offices and think, oh, syphilis is a really great problem for other people out there. And actually, when you go to the community, syphilis is not their problem at all. Maybe it's lack of water or lack of jobs. So whenever we come up with our research ideas, we have to make sure that's a pertinent issue for the community we want to work with. We have to determine if the research has been done before. And of course, the way you do that is by doing a literature review. And a literature review will be able to tell you where it has been done and how it has been done. And then from there, you may determine the angle that you may want to take. You may not want to take the exact angle that people have taken in the past. You may want to take another angle, but it's very important to know what has been done before and what other issues you may want to explore. Would it change policy or practice? That's very important. Will it attract funding? Because for all our research that we want to do, we have to be able to attract funding. And there are just some ideas which might be very exciting, but may not be able to attract funding. And you may think to yourself, let me do other research. Is it exciting? And this is really important for those who are doing PhDs. This is a long journey, between 3 to 4 years. And if your idea is not exciting, around the second, third year, you feel like exiting your project. So it's really important that it's exciting for you, but also exciting for those who you're approaching to do your research. Is it aligned to state and national priorities? And one of the things, especially when you're writing up NMHRC or ARC grants, one of the ways to make your proposal and research question really, really fundable is to look at the state and national priorities. Is it high up there in the priorities for example, in sexually transmitted diseases? You may look at the Aboriginal state guidelines and all that. Is it an important issue? And that is, if it is, then it's more likely to attract funding. And as I've said, a research question should be exciting, it should be evocative, it should evoke people, and people should be able to see how relevant and exciting it will be for you and others. The research question, as I've said, is very important, and one should give themselves time to refine the question. As we said earlier on, read and talk to people and find out what others have to say about the topic and what has been conducted before. Write your question down, and one of the things we learned when I was doing my PhD is, write it down. At least it can be edited. If it's not written down, it doesn't exist. All research questions should answer the so what test, and many people ask when they're reading through your proposal or you're looking at your research question, they'll say, really, so what is this? Is it really important? One must be very careful when they're developing their research question to make sure it's not too broad or too narrow, and one should be able to determine, depending of course on how narrow or broad it is, whether it's enough for a master's project, an honors project, or whether it's a PhD question. So of course, PhD question should be much more broader and much more weightier than an honors project, for example. As I said, it's because of the pivotal role that the research question holds, it's important to spend time brainstorming, researching, and conceptualizing your project. The question. It will make the next steps much easier. So as I said earlier, I sent around that reading, and I don't know if did anyone have an opportunity to read it? The river question paper, what is your research question?
I'm sorry, Barbara, I was away. I didn't get an opportunity.
That's all right. If you have time to read it later, it's a good paper.
Did you send it out, or did it come from your email?
It came from Louise. Louise sent it out twice, I think. So the reason why I like this paper, it's a paper written for a chiropractic audience, but I really enjoyed the paper because, to be honest, I'd never thought about this format when I'm thinking about developing a research question. I've developed research questions many times in the past, but I never actually thought about this format. Now, just to be clear, the paper makes it clear that this format is not useful for all type of questions, but it's a very good, particularly if you're doing a randomized control trial, or even a systematic review, it's very good to use this format when you're writing your research question. So in the paper, it says P is for population of interest, I is for the intervention or your exposure of interest, C is the comparator, O is the outcomes, and T is the time duration of data collection. So I'm going to ask Belinda, let me put you on the spot. So starting with question number 1, what is the PICOT in the first question? So what is the population in the first question?
Okay, let me just read this.
Okay.
Sorry, I was distracted by other work while I was listening. So adult population with probable obstructive sleep apnea.
Okay, so that's the P. What is the intervention?
Overnight oximetry testing, don't know.
Okay, what is the...
Sorry, I was reading out loud then. So the overnight oximetry testing, does it diagnose it as well as a sleep study? So the intervention is the overnight oximetry testing.
Okay, and what is the comparator?
Oh, the overnight sleep study.
Okay, what is the outcome?
The diagnosis, is it? Overnight diagnosis. The diagnosis of OSA, obstructive sleep apnea. Is that the outcome? so that it does. Hang on. So the outcome is whether or not it has diagnosed it, as well as the overnight sleep study.
Okay. And what is the T?
What was T again?
T is the, sorry, we need to go back.
Sorry, yeah, I haven't got it in front of me. Oh, the time, the duration of data collection. And this is just for number one? Is that what you're
number
asking?
one. This is number one. I'm going to give Kutsi number two.
Okay. Well, I don't really, it's just the overnight, but I don't know how long their study is going for.
Oh, okay. All right. That's clear. That's all right. That sort of was a trick question. So not all questions would have a P-I-C-T-O, but at least we can see that it has a P-I, a C, and O. So Kutsi,
I think with this, like this format we use a lot with the medical students, and every research question always has a P and an O, but sometimes they don't have the other thing. So don't get too worried. If they don't, they don't. It's okay.
All right. So Kutsi, number two.
Yeah.
And Annie, get ready for number three.
Yeah, so it's for the P is patients who have experienced an acute myocardial infarction.
Okay.
That's the P. And the I is intervention, yep.
Okay, there's no intervention
I
here.
can't see the intervention there.
Okay.
That's right.
Or there actually is. It's just that the intervention is not something you would do to the person deliberately, but it's something they've done to themselves.
Oh, okay, yep. And C was, the comparator is to a non-smoker.
Yeah.
The O outcome, well, that's the infarction rates during the first 5 years after the myocardial infarction, yep.
Okay. Death and infarction, yes. And then the T?
The time, first 5 years after it.
Okay. All right. So the next one will be easier for Annie because that's it is I think it has all elements in there. You need to mute Annie. You need to mute. Sorry, unmute, sorry.
Sorry. The people of interest are the 25 to 40-year-old age women.
Okay.
Who take oral contraceptives and women who take intrauterine, who have an IUD.
Okay.
The intervention, well, there's not actually an intervention, it's just a comparison.
Yeah.
So the interventions that are already happening to themselves.
Yeah.
So the comparator is comparing women who take oral contraceptive compared to women who have an IUD.
Yeah.
So they're comparing it to the IUD women. And the outcome is blood clots.
Yeah.
I'm not really sure how they're going to measure that, but it says blood clots. And then time duration of data collection. Obviously, you're going to do it over a 5-year time frame, but it doesn't tell me how many times or when, how much longer after you started the contraception.
All right, thank you. And Claire, though I'm not building your capacity, can you do number 4?
No, I'm handing over to Stephen to build Stephen's capacity.
Oh, Stephen, sorry. I keep forgetting because I can't see you.
That's exactly why it's over there, I reckon.
So the population is children with otitis media.
Yeah.
The intervention is antibiotic therapy.
Yeah.
The comparator is the delay of antibiotic therapy compared to the usual therapy.
Yeah.
The outcome is the difference between the two, and the time is 10 days.
All right, thank you. All right. So as Donna said earlier on, all questions may not have the PICTO in them, but at least it's a good way of constructing a question. Of course, this would not be used for qualitative studies, for example, but in a qualitative study, you may have a P in it. You may have your population. You're not, of course, comparing anything in that regard, but this is a good way to think about it when you're developing research questions. So one other task I sent out to the group, I think 2 people responded, which is fine, was just how it was just to reiterate the difference between a question, a hypothesis, and an objective. And this is usual if you're doing a quantitative study, which is testing. The hypothesis would be if you're testing two, trying to prove one against the other. So to those who responded, I'll send your responses back to you. But for example, I think in Kutsi's regard, you wouldn't have a hypothesis for your question. But this was just an example which I tried to use where I was trying to compare what the question would look like, what the hypothesis would be, and what the objective would be. So in this case, my question would be, how does point-of-care testing compare against standard care in increasing the number of young Indigenous clients tested for sexually transmissible infections? And this question, I was developing it for urban sites, and as I said, it's on hold at the moment. So my hypothesis, which I would have been testing, would be that a higher proportion of young Indigenous clients would be tested for STIs with point-of-care testing compared to standard care, and that would be the hypothesis. And all my p-values and tests would be trying to prove that point-of-care testing is better than standard care. And my objective would be to investigate the effectiveness of point-of-care testing in increasing the number of young Indigenous clients tested for STIs. So it's the same thing that I'm looking at, but developing the question, hypothesis, and objective. They're slightly different, but they're all around the same issue. So as I said today, we are only going to really concentrate on qualitative methods. And just before we go into this, if anybody wants to have a quick stretch or grab a quick coffee, so that we sort of get ready for the next session, which will be a maximum of 30 minutes. So if anybody wants to use the bathroom or take a drink of water. Claire, let me know when Casey's back in.
And who's back? Because Frida's gone to the leave. She'll be back in a minute, but we're all here.
Okay, let me know when she's back. Then I'll continue. Okay.
Yeah, she's right. Yeah, so we've lost Belinda, and Gary couldn't connect properly, so he's disappeared too. So what we're going to do with these is send round web links so that people, I think we've done it before for our PRPs, but yeah, so we'll send them those links a bit wider for people to catch up with these series in their own time.
Okay. Is she back yet?
No, I think you'll be right. Just start.
I continue. All right. So, of course, after we've developed our wonderful research question and have discussed it with several people and made sure it's refined and well, the next thing we have to decide is what the choice of our design and method is going to be. Now, our design and method, of course, is dependent on our skills. That's the most important thing that we have to remember, that we don't want to choose a design that we're not strong at, or at least we don't have the access to that expertise, but also depends on the amount of resources we have. So if we have a limited number of resources, we have to basically cut our coat depending on how much cloth we have. So our key research questions are what would also drive the selection of our design and methods. And we must remember that there are always strengths and limits to all designs and methods. Even randomized control trials, which everybody says is the best way to produce knowledge, people have always said that there are limitations to what an RCT can do. So we have to take that into consideration when we're doing our studies. And more people are combining and using both mixed method, using both quantitative and qualitative designs and methods in order to answer their research questions. So, for example, you may decide that you want to do a mixed method study instead of just doing quantitative or qualitative study. So this is just a broad presentation of quantitative research versus qualitative research. And on the left-hand side, we have the quantitative research designs, which include the experimental, quasi-experimental, and non-experimental. And below that, we have the methods, which are surveys and questionnaires and structured observations. On the right-hand side, we have qualitative research designs, and those I've listed there are just 5 of the many. And below that, we have the interviews, observations, document analysis, but there are other ways of collecting qualitative data, and we'll go into that later. So just really quickly, the difference between experimental designs, quasi, and none is that in experimental designs, we have manipulation, control, and randomization. So the researchers are deliberately and consciously controlling the independent to see its effect on the dependent variable. So for example, a study where someone is being given medication and we want to see the effect on their high blood pressure. We have control because in an experimental study, we're trying to determine cause and effect. So we must have a control group in which who do not receive the intervention, so that we can be able to say clearly and strongly that the effect that we see is due to the intervention and not due to any other reasons. We must have randomization, therefore, so that everybody who is involved in the study has an equal chance of being either in the control group or the intervention group. Because if there is no randomization, we run the risk of having bias. In a quasi-experimental design, there is no control group. There's a control group, but people are not assigned randomly. The weakness of a quasi-experimental design, therefore, means that you introduce confounders, because there might be something in the other group which has had an effect on the outcome, which you cannot know. It's in experimental designs where if people are put randomly in 2 groups, you have randomized the confounders. But in a quasi-experimental study, that does not exist. And in non-experimental designs, there is no control group at all, which of course means that it's, again, a weaker study compared to an experimental study. And as I said earlier on, there are several qualitative designs, and those are just some of them. So again, as I said earlier on, when you're selecting your methods, you must think very hard about the ethics of it. You must think about your resources, but you must also think about the key audience. There's some people who do not believe at all in qualitative research methods, and they only believe in quantitative research methods, for example. So when you're developing your methods in the very beginning, it's good to consult with people early on and determine what they are interested in, or what for them is what we call science. There's some people who do not believe in quantitative methods at all. They prefer qualitative methods, interviews, and focus groups. So that should be ironed out very early on in your process. And as I said earlier on, many times people use more than one method because they believe that having more than one method gives you a more holistic view of the issue on hand. So the major difference between qualitative and quantitative methods is that qualitative methods emphasize reporting on themes, narratives, and words, while quantitative methods, their emphasis is reporting numbers, patterns, or being descriptive. And as I said earlier on, most research involves more than one type of method. So now we'll talk about qualitative methods, and in the next session in June, we'll go into more detail about quantitative methods. So qualitative methods, the key features of qualitative methods is that qualitative methods focus on understanding and meaning. So when we approach our research, we're more interested in understanding quantitative research we want to understand, but to a degree, qualitative research, we want to have an in-depth understanding of the issue at hand. It's an emergent design, meaning that sometimes when we go into a qualitative study, we try not to fix our protocol too tightly. We want the data to sort of emerge from the discussions or when we're having observations as we're interacting with our clients, or with our patients or participants. So from the word go, we're not fixing or making putting our research protocol in stone per se. Things can change as we collect our data. In many cases, you actually have concurrent data collection and analysis. So as you collect your data, you analyze it, and then you go back to the community when you've analyzed your data and had a look at it, and go back and sometimes even change or reform your questions as you go. There is a strong acknowledgement of the role of the researcher in interpreting the results and co-creating findings with the community that we are working with. In quantitative research, many times people say we're objective. We pull ourselves away from the data and we analyze it in an objective manner. But in qualitative research, we always admit to ourselves as researchers what we bring to the research and how we ourselves may have an impact on the findings. We usually, when in qualitative research, you have a purposive rather than a probability sample. So you're not looking at people you're not collecting data from people who are selected in a probability way. You are purposively looking for the people who you want to be involved in your study. So for example, if your study is on youth, you will go and look for young people, young Indigenous people, for example. You will not be looking for a random sample of young people across the community. The emphasis is on collecting data in a natural setting, and usually when we sit down with our participants, we'll sit down either in their homes or what. We don't want to have, we don't want to collect data in a unnatural setting. We want to have it as much as possible within the setting which the participant is used to. The focus, of course, is on context and holism. When we're analyzing our data, particularly we look at the context in which people live. We're not trying to remove them from that context, but we're trying to understand their life, their lifestyle, all within the context. And so not only just the individual's context, but also socio-ecologically. So for example, we may look at young Indigenous people and why they're getting high levels of infections, but we may not only look at them as individuals, we may look at the community, we may look at the society, we may look at the nation, and all the different ways of colonialism, racism, and all those other things that might have impacted on their lives at that time. So we're trying to look at it in a holistic manner. And reporting is expressed in a narrative or case study forms. So we're not interested in numbers, we're interested in the words of what people say. So there are several types of qualitative methods, and today we only have time to discuss interviews, focus groups, and observational methods, but there are so many other qualitative methods that one may use. For example, and quite a number of people use document analysis, but we won't talk about that today, but that's essential if you're doing a qualitative research. The most significant technique is relatively new technique. It's used a lot with people who do evaluations, but it's also a strong methodology for qualitative methods. People use photographs as well, but we do not have time to discuss all these. But so we only concentrate on those three which I've highlighted. So Interviews. Cavale says that if you want to understand people and their life and their way of life, why not talk to them? So an interview is basically a talk. So, I mean, it's not, I mean, it's done in a systematic way, but it's talking to people and finding out in depth about their lives and their communities. A qualitative interview is a method that attempts to understand the participant's point of view and how they see the world. So it's not about how I see the world, but about how my participant sees the world in which they live. An interview is literally an exchange of ideas between two people talking about something of common interest. Consider using interviews when you want in-depth knowledge about the subject matter. If the subject matter is complex and or sensitive and you don't want to use a survey to collect information about something in particular, it's good to use an interview. And also when you think that the perceptions and knowledge of your stakeholders is important. So for example, we may be interested in looking at health services and how many tests they do, and we want to know from their angle, from their perception, why things are the way they are. Because a lot of times we may sit in our offices and make assumptions about why the things are the way they are, but we may want to know it from the stakeholders, and their knowledge, of course, is important in that regard. You can have an individual or a group interview, and we'll talk about focus groups in a moment. The interview may be face-to-face or by phone. More and more we are using phones to have interviews with people. However, the problem with that is that you don't get the body language when someone is talking to you. The unfortunate thing, of course, we can't drive out or fly out to all the people we interview, and sometimes we're doing research across states or across the nation, and the phone has become a necessary evil. But the face-to-face interview remains, I think, one of the most important aspects of an interview, not, as I said, only listening to what they say, but also looking at their body language and making interpretations from that. An interview can be open or close-ended. It can be structured or unstructured. When you're thinking about an interview, think very hard about taping it, because of course you want to collect as much information and go back over the interview and transcribe it. However, do know that a lot of people don't like to be recorded, and I'm one of them. So think very hard about whether or not you want to tape your interview. And of course, establish a relaxed atmosphere, because you want to know the person's perspective, and if people are not comfortable, they may not be able to get to what you really want to know, the important information you want to know. The type of questions you may ask in an interview, of course, it's important to ask demographic or background questions, because you don't want to go back later on and then you've forgotten what the age of the person was, or their background, or where they came from. So remember to ask some of these questions. You may have experience or behavior questions you want to ask, their opinions or beliefs. You may ask feeling or thinking questions. You may ask about their knowledge. You might have advocate sort of questions where you want to really probe someone and get to know what their opinions are about a particular issue. Or you may have descriptive questions where you ask questions, a broad question about, tell me about your experience with healthcare delivery, tell me about your experience with sexually transmitted diseases. So there are different types of questions you may want to ask in your interview. Yarning, and I don't know if any of you has come across this paper by Dawn Bezerab. Dawn Bezerab is a professor at UWA, and she wrote this paper in 2010 with Bridget Ngadu, who is from Zambia, Botswana. And it's a really good, and I think it has been, one of the most highly cited papers in Aboriginal health, talking about yarning as a legitimate method of Indigenous research. And in their paper, and so it's a sort of interview, but they go into in-depth about how yarning can be used in Indigenous research. And they talk about social yarning, research topic yarning, collaborative yarning, and therapeutic yarning. And all these forms of yarning are done at the time when you're doing your yarn interview. So they're not separate, they're part of the yarn interview in itself. So the social yarning is where you begin. So you're having a social conversation and making the client or participant comfortable with yourself. Very unstructured. It's about getting to know the person, making, as I said, making them comfortable and getting them ready sort of for the main interview. But it's an essential part of the interview, part of the yarning, and making the person very comfortable. You may tell the person about yourself. The person may tell you about themselves. They may catch up on the local gossip and all that sort of thing. So it's really getting into the yarn. So then you go into the research topic, and it's a gradual process where now you're getting into the conversation about the research topic in particular. The therapeutic yarning, they emphasize, and I've heard Dawn talk about this, because a lot of times when we're doing research, particularly with vulnerable people, and in this case, Aboriginal communities, sometimes the topic we may talk about may sort of, in a sense, re-traumatize the person you're talking to and bring back memories of disempowerment, bring back memories of racism and other disempowerment that people have gone through. So she says it's very, very essential that if you're going through the yarn and this comes up for the person you're talking to sort of quickly put the research topic aside and go into a now sort of therapeutic yarning phase. Because you cannot, in a sense, you cannot leave, you cannot quickly jump back and bring back your topic when someone is hurting. So it's really essential that one thinks very hard, particularly about that therapeutic yarning when you're dealing with vulnerable communities. And this might not be just for Indigenous people. This might be women who have gone through domestic violence, or people who have experienced sexual abuse. But basically what will be happening is that during your interview, you may have to go slightly leave your topic and move on to a sort of therapeutic phase, where at least you're listening to what the person has to say and not rushing them back to your research topic, because you don't want to harm the patient as you're doing your research. So some basic tips about interviews is about listening carefully, tape recording, ask for permission if the person wants to be have the tape recording on. Practice interviewing, of course, with your friends and family beforehand, so that you can get improve on your technique of interviewing. Observe the interviewee. That's very, very essential. Observe their body language. Use probes, because sometimes when you're in the interview, someone may go off topic, or they may go quiet, or they may not answer your questions in length. So you use probes in order to get them back either on the topic or get more information out of them. It's very important to be empathetic, neutral, and non-judgmental. Recently, I had an interview with someone, and I realized that she wasn't really being judgmental in a verbal sense, but she was judgmental. Sorry, have we got someone online, Peter?
Okay.
Welcome, Peter. Do you hear us?
Yes, I can hear you.
Okay, all right. Welcome to the seminar. We're about 30 minutes in, but you're welcome anyway.
Yep. Thank you for that.
All right, thank you. So it's important that you're non-judgmental, not only, as I said, verbally, but also body-wise. So sometimes people might be talking, and I'm told, for example, crossing your arms is a very judgmental stance. So be very careful how you're positioned when you're interviewing. Of course, it's essential to get informed consent, and it's good to take a notepad, not only to take notes about, just in case someone refuses to be interviewed, to be tape recorded, but also if you want to take extra notes, or if you want to take some observation about the interview, and of course to write down information about their demographic issues and the like. So the strengths of interviews are that they yield rich data and provide deep insights into your participant's life or project, whatever it is. They have high validity, and And the interviewer can adapt questions and style to the respondent as you go. However, they can be timely and costly, and time-consuming. It requires considerable expertise. It requires considerable expertise and training. People can be social desirability bias, and one must be very careful. I remember when I was back in Africa a few years ago, I tried to do interviews on my own, and I realized that because people knew me and they knew me in my past as a medical doctor, it was very hard for me to get information out of them because they wanted to please me and tell me what it is I wanted to hear. So take that into consideration when you're doing your interviews. Unfortunately, because the interviews, there can be a lot of flexibility in it, this may lead to inconsistency across interviews. So some interviews may look different from others because there's a lot of flexibility built into the interview method. And of course, it generates a large volume of data, which has to be transcribed and analyzed, which might take up a considerable amount of not only your time. So if one is thinking about interviews, think very hard when you're thinking about your resources and how much time has to go into an interview. So focus groups, so we move on now to focus groups, which are basically an interview, but in this regard for a larger group of people. It's a technique involving the use of in-depth group interviews in which participants are selected because they are purposive, though not necessarily a representative sampling of a specific population. It involves elements of interviewing, as I said earlier when we talked about interviewing, but also participant observation. A suggested number of participants is between 6 to 12, so you don't want a very large focus group, but you must not only have a facilitator and a very good facilitator at that, but it's important to have an expert who can take notes or co-facilitate. And the issue about a focus group is that it capitalizes on the group dynamics. So it's not just about retrieving information from a group of people, but you want to see and understand the group dynamics. And we'll talk about this especially when you're selecting groups, how to be very careful that you select a group where you get information and nobody's shutting down anybody else. And as I said, it's important to have a very skilled facilitator. That cannot be overemphasized because sometimes you have people who talk too much and then those who don't talk at all. So you must have someone who's able to manage the focus group well. Consider using when you can get can assemble people within one location. So possibly a focus group won't be very useful if you have people scattered all over a state or across the nation. I don't know if people now would use teleconference focus groups. I don't know if that's possible at the moment, but at least in the past they've always been used where you can assemble a group of people. It's important that your subject matter is not so sensitive, because if we're talking about things where people may have to reveal, for example, maybe their sexual behavior or something like that, it might not be a good method. However, if you're talking about breast cancer, where people might be more willing to share their information, would be a better methodology for them. The number of groups you have, of course, depends on your resources. And if you have very complex topics, you may have fewer participants because you want to encourage reflection and discussion. So when you're sampling in focus group research, think very hard about who has the greatest amount of insight into this topic, because you don't want to call the wrong people into and sample the wrong people for your research question. What type of people do you want to be able to sample, and who have to say something about this particular topic? Avoid mixing people who have different levels of power, expertise, or status. So for example, if you have a focus group about maybe for young people, make sure you don't put old people in there, because young people will not speak up at all. And for example, don't mix males and females, for example, in cultures, because the women will not speak when the men are present. So be very careful about how the groups as you develop them. It's important to oversample.
There's some very strange noises coming.
Trying to.
I think someone needs to mute because it's a really weird echo and I can't hear Barbara.
Is everybody muted? Okay.
Okay, I think I've muted
Peter.
Peter. That seems to have worked. Ah, off we go again.
Okay.
Yeah.
All right, and it's important to oversample because not everybody will attend. So if you aim to have about 6 to 10 people in your focus group, invite about 14. So that you don't want to get to your focus group and nobody has turned up. So make sure you oversample just in case some people don't come. So there are different types of design options when you're doing a focus groups, and I've provided the reference there. So for example, you may decide that you want a single category design, and for example, in this case, we're looking at women with breast cancer, for example, and we may want to have 3 groups of young women, 3 groups, focus groups with all young women in a particular age group. Or we may want to have a multiple category design where we are looking at women in different age groups and different number of groups. So we may, for example, have women aged between 35 and 45, women aged between 46 and 56, and then maybe a separate focus group for just breast care nurses. So in this case, we will not be mixing women across age groups, and we will not be mixing patients and nurses, for example. Or we may want a double layer design, for example, where we have a focus group of people in metro and rural areas, and we have at a different layer, so we say metro and rural, and under metro we have women and clinicians. In metro, then we have women and clinicians. So think very hard about the way you want to develop your focus groups. Or you may want a broad involvement design where you have a broad number of people and age groups. The strength of a focus group is that the interaction of respondents can stimulate insights into the topic. For example, if you want to talk to young people about, for example, drug use, they may give you a new insight around how young people, how they, for example, use drugs, where they find them and the like. The strength that, of course, they have larger samples than interviews, and it allows you to observe the group dynamics. However, some of the weaknesses that the range and depth of responses can be limited. So, of course, people may not want to speak about themselves in particular. So, especially where they are very sensitive topics. So, you may not go into in-depth about the topic that you want, that you're exploring. And the group dynamics might inhibit some people from participating. For example, if you have introverts and extroverts in the same group. So it's important that you have a good facilitator who will sort of tempt the extroverts and get them to speak less and get the introverts to speak up more. And of course, it can be very hard to record and transcribe a focus group if people are talking over each other and there's a lot of noise. People may find it very difficult to transcribe. And not only that, to also allocate to who said what during the interviews. So the last method we're going to talk about this morning is observation. And the reason why I chose these 3 methods are one is because they're most likely to be the methods that you may use during your research or have used in the past. And observation is one of the essential methods that a lot of people don't use at all, but it's an essential way of collecting data. And of course, you wouldn't use it on its own. You would use it with other methods as well, but it's a very good way of triangulating your information. So, for example, people could always be telling you that this is their sort of behavior, but when you put observations as one of your methods, it will be able to reiterate whether or not that's exactly the way people behave, or whether it will be different from what actually people say about what they do. It's a method linked to ethnography, and I think in the past it copped a bad rap. People used to think that it was not well done, but I think over time people have refined the method and made it a bit more ethical. So the role of the observer varies, of course, on the extent of participation. So there are some in some regard, they call it participatory observation, where you actually become a participant, and there's non-participatory, where you're sort of standing away from the people who you're observing, and you differ. For example, if I may decide I want to become just to give an example, I may want to an observation of sex workers. So, for example, I may become one in order to have an in-depth knowledge of sex work, or I may stand away as a researcher and be a non-participant observation. It can be overt or covert, but usually it's best for it to be overt, that people actually know that you're observing. Of course, it's problematic because the fact that you're observing and people know that you're observing may change their behavior. But if you've lived long enough in the community, over time, people may become comfortable enough to behave the way that they normally would be, because it's unethical to be covert and you're just hiding and pretending not to be observing. You may consider using photographs as part of this method, and it's important that and we'll talk about structuring your observations in a moment. So the role of observation in research, it involves more than just looking. As I said, it has to be done in a structured, systematic way. It's not that you're just looking as you walk past in a community. There must be particular things that you're looking for. We usually fail to observe because we are not prepared to observe, or we are not trained to observe. So, as I said, this is a research method. So as we're going into the community, we have to do it as I said, in a structured way, and we have to be prepared to do it. And it's, as I said, it's not a trivial exercise. The advantages of observation, as I said earlier on, means that you're able to triangulate the results the findings that you have an in-depth understanding of the community, and you're able to understand the context. So, for example, if I'm doing participatory observation up maybe, for example, in the Kimberley and living with the community, I've been there a long time, I'll be able to understand the context in which, for example, syphilis is being transmitted. For example, Donna has lived in the Northern Territory, northern part of Australia for a long time. So having lived there and having observed, she's able to have a better understanding of the context than, for example, someone who's never been there before. Having first-hand experience means, of course, that you're less likely to rely on preconceptions, or that if you did have preconceptions at the beginning, that your preconceptions will change after a while. Systematic observation enables you or the observer to see things that otherwise might have not been noticed or seen. And we can learn things that people are not willing to talk about in interviews. So you may want to talk about someone's behavior in an interview, and they, of course, because it's a scary environment or one in which they're not comfortable, they won't tell you everything. But if you live with them long enough and observe their behavior, you'll be able to see things that they're not willing to talk about. And as I said earlier on, that observations are used in conjunction with other methods, which help you gain a better technique. So tips for using observation, as I said, it must be done in a structured manner. You may want to draw a map. For example, you may be going to a community and you may want to draw a map beforehand, or a diagram or a photograph, so that you're very clear about where you want to observe and where it is exactly you want to go. The important thing, as I said, about writing is that you're writing beforehand, before you go into the community. You're doing it in a structured way, but also you're writing when you're in the community as well. And on the right-hand side, I've differentiated between the notes that you may take, that you may write to yourself about your observations, and then the actual observation that you have made about, for example, in this case, this was an example of a room, but you may also want to make an observation about the community. So, for example, you may I gave some of my students an example about exercise. So you may walk into a community and you realize that people don't have parks, or people don't have areas to do their exercise. They don't have anywhere to walk. So you may want to write down some of these observations as you walk around the community to see what impact the environment has on their health or their behavior. And it's very essential to remember we can't observe everything. So that's why you have to, before you go into the community, you're very clear about what it is exactly you want to observe about people's behavior or about the environment beforehand. So the strengths of an observations is that it gives you contextual information about individual group behavior, and this is for a range of conditions. It occurs in a natural, unstructured, and flexible settings, and it permits you as the researcher to enter into and understand the situation or context in which you're conducting your research. But as I said, of course, ethnography and participatory observation has always had ethical problems because a lot of people in the past used to do it in an unethical manner. Taking notes can be difficult, especially if you're in a community setting. Taking notes as you're walking about, people may wonder why you're writing as you're walking about. So sometimes you may have to take notes afterwards, or maybe take a tape record or something like that. It may be time consuming, particularly if you're not doing it in a structured way, but it's very essential that you have to be prepared to observe and be very clear before you even start about what it is you want to observe. As I said earlier on, observation may affect the behavior of your participants. So it's very, very essential to develop rapport and so people are comfortable with you and comfortable with your presence. Otherwise, you may not find the knowledge you're trying to seek. And selective participation of the observers can bias the process. So we're about to wrap up the discussion about qualitative methods, and I'll just briefly talk about sampling in qualitative methods. We must remember that you're able to sample both in qualitative and quantitative methods, and the sampling methods are different. But the reason why we sample is because we can't gather information from everybody. That is impossible, whatever type of study we are trying to do. So the important thing about sampling is that we are trying as much as possible to collect information from a core group of people, which will give us the richest amount of information possible on the topic that we have chosen. Your sampling strategy, of course, will depend on your questions and the characteristics or resources that you have. But the most important thing to remember is that you're selecting the people who will give you as much information as possible about the topic that you're following. So, for example, if your topic is about sexually transmitted infections and men, for example, you not necessarily sample women. But even within the men, you may decide, I want to particularly sample a particular age group. But even within that age group, you have to be able to select the young men who give you the information that you need. So, because you can't get to all men, so you have to decide on the best sample for your research. So on the right-hand side, we have the most common types of qualitative sampling, and they are convenience sampling, snowball, purposive, theoretical, and grounded. And all these are different types of sampling, and of course it depends, of course, on your resources and your research question. So, for example, snowball sampling is where you, for example, interview Barbara, and Barbara is a core participant in your research. For example, maybe she's a sexual health worker, and then you ask her that, Barbara, could you tell me of any other sexual health workers that you interact with on your daily run or something like that? And then I'll refer you to the next one, and then that they refer you on to the next. So it's sort of like a snowball moving from one to the other. And you'd use this method if, as I said, there's a specific group of people who you want to reach, but it's difficult for you to access them all. So what you're hoping is that your participants will be able to get you the other people along the way in order to help you increase your sample size. Purposive sampling, again, particularly is one where you're looking for a purposive group of people. So in this case, again, back to sex workers, you're looking for sex workers particular, and you're purposively sampling them. So you're not going to sample from another set of the community. You're purposively looking at that group of people. Convenience sampling is commonly done, sorry. Sorry, I thought someone spoke. So convenience sampling is where you're, for example, standing in a supermarket and you're just conveniently getting the people who come by you. So you're just getting the people who are within reach in a sense, and you're not looking for any other people but the ones who you can quickly gain access to. Or, for example, in a clinic, you may want to be, you might be doing research, for example, on antenatal mothers, and you may be looking at the first antenatal mothers who come through the door. So basically, it's convenient, the ones who you can conveniently gain access to. Grounded theory sampling is a bit more complicated, and it is more a theoretical way of sampling. So those who've used grounded theory, which is a qualitative method of research, there's a particular way in which you sample members of the community who are in regards to your research. But particularly it is done as you analyze the data. You look at your data, you look at the findings that come from your data, and then you select who else you'd want to sample based on the information that you have. So still under qualitative sampling, we have extreme, maximum, variant, homogeneous samples, or typical case sampling. So in, for example, extreme or deviant, you might be doing a study, for example, on, for example, sexually transmitted infection, health services, for example, and you may be looking at those who, you want to sample those who have very high testing rates on one side, and on the other side, you may want to sample people who have very low testing rates on the other. So you're particularly looking for a particular group of people, and all this is under purposive sampling. So you want people who are extremely different in order for you to have findings about two different groups of people or communities. Homogeneous sampling is where you would sample the exactly people who are similar to each other. So you may be looking at only sampling people who have services that have very high testing levels, for example. You're not interested in other sampling groups. So those are just some examples of sampling. So just now we're about to summarize, and we're talking mainly now just about qualitative analysis in particular. Unlike quantitative analysis, qualitative analysis is a very iterative process. Usually in quantitative analysis, you collect your data, and once all the data collection is done, you analyze it. In qualitative research, a lot of times we are collecting our data, we are analyzing it, we then go back sometimes to collect more data, depending on whether or not we think our research question has been fully answered. So it's a very, very iterative process, and that's when I talked about earlier on when I talked about an emergent design. So nothing usually is fixed a priori beforehand. It's about going back and again and refining your data, looking at it and going back to collect data. So that's why it's a very time-consuming process, but it's an essential part of doing qualitative research. So as I said, you collect your data, you familiarize yourself with it, and read your transcripts, you listen to the recordings again, you're sort of immersing yourself in the data and getting a deep understanding of it. However, we must remember that when we're finally writing up our reports or studies or whatever, we can't, the data that we've collected, and which is all within our the data that we've collected, we can't present it the way we've collected it. It must be reduced, it must be interpreted, and then it must be written up. So we have to be very careful about the way we present our qualitative data. Some qualitative information can be converted to numbers, but that is really not what the essential thing that we're looking for in qualitative data. What we're looking for is to code it and to put it into themes, and that is how qualitative data is usually presented. Sometimes it may be presented in a narrative or case study format, but mainly most of us, a lot of us who are doing qualitative research, do present it in a thematic way. So I've provided a paper by Leach which you can read during your free time. And it talks about the major sources of data, which are talk, documents, observations, and drawings, and that's on the left-hand side. And on the right-hand side is the numerous ways in which qualitative data can be analyzed. And that this slide is just basically that in a diagrammatic form, where basically she's saying, or the authors are indicating, in the various ways in which talk can be analyzed, the various ways in which documents can be analyzed, observations, drawings or photographs, which are numerous. So if you have time, please read through that paper in length. And I've provided 2 extra readings, one on how to analyze qualitative data, but also on focus group interviews and data analysis. So the rest of the slides, Donna, are for the next session. If anyone has any questions for me or any of the other researchers online, please let us know if there's anything you want to know now.
Yes,
about qualitative data or otherwise.
So thanks for that, Barbara. I think we're going to have to not take questions now, mainly because there are people that wanting to come into this room next. But that was a really good overview of qualitative research. I know that I'm going to be sharing this recording with on a student of mine who's just starting some project that's going to be including a lot of focus groups. So that'll be great for her, and I hope that other people who are watching it will equally find some benefit in that. So looking forward to quantitative next.
Yes. All right. Thanks, everybody. And again, as Claire says, we can't have a discussion now, but if you have any questions, please send them through. And I probably won't be sending you any tasks for the next session, but please, if you can, please listen to recording and attend the next session in June.
Excellent. Thanks, everybody.
Thank you.
All right. Thanks, everyone.
Bye-bye.
Bye.
Very good.